Hello and welcome to EULAR TV. We're here in beautiful Barcelona at the EULAR 2025 Congress, and I'm here with you again. My name is Maria Sokolova. I'm a medical doctor and researcher at the University Hospital Schleswig-Holstein in Kiel, Germany. And it is my big pleasure today to interview Professor Gravallese. She's a professor at Harvard Medical School and also chief of rheumatology, inflammation and immunity in Brigham and Women's Hospital in Boston, Massachusetts. Thank you very much for taking time during this busy congress to be with us.
It's my pleasure. Nice to see you.
And we are meeting actually today directly after the session where you gave an excellent, very insightful talk. The session was called Histopathology of Synovial Tissue. And you gave us great insights, and I was wondering maybe you can summarize some of it for our audience to expand a bit on the topic of what are the best ways to analyze synovial tissue.
Sure. So the original work that I did on synovial tissue actually looked at a very specific site in the joint, and that is at the pannus interface with cartilage and bone. And that's the site of joint destruction because that was what we were very interested in understanding. When you get a synovial biopsy, in the biopsies that we're doing now, you actually don't get that tissue. You get synovium that's remote from the bone and cartilage, and so it is a very different histology, and I think it's really important to understand that. What you're actually looking at is a tissue remote from bone. And I think there are a number of different techniques that are being used to obtain that tissue. The two most popular, I would say, are portal and forceps, and then also needle biopsy. So with a portal and forceps, you introduce a trocar into the joint and you thread the forceps. And it has a pincer mechanism on the end, and you can actually snip off the very superficial lining of the joint. And that's the tissue that you want to get. You want to get the synovial lining and the tissue immediately deep to the lining because that really is the most important tissue from a pathogenic standpoint. But you also can get lots of different samples with it. So you can maybe get 20 or 30 fragments with the portal and forceps technique. The other technique is a needle biopsy technique. And with that technique, you get fewer fragments typically, and it's a little trickier to get that synovial interface, that the lining layer and the deep synovium, because the needle is thrust forward at a certain distance, and if you don't put it exactly in the right place, you might get deep synovial tissue. So you have to be knowledgeable about how to use that technique. But I think both of those techniques are valuable in terms of gaining the tissue.
Yeah.
And then in terms, did you want to know about the techniques that are used for analysis of the tissue as well?
Yeah.
Yeah, so we have, sort of the workhorses have been single-cell RNA sequencing and also site sequencing, or site-seq, so that we can get gene expression and also the protein expression on cells. And those techniques are done on cells that are dispersed from the tissue. So you get the tissue, you disperse the cells away from it, you deconstruct the tissue, if you will. And more recently, people are doing spatial transcriptomics, which allows you to reconstruct the tissue. And what you do there is you can actually get a section of the synovial tissue, and it's placed on a slide that allows you to identify gene expression. There'll be probes for about 5,000 or 5,000 plus genes, and then you can actually see where those genes are being expressed in what cells. So that is a very powerful technique, and it also allows you to look at neighborhoods of cells, so you can look at cell-cell interactions, and it's very powerful in identifying pathways. And I guess the other thing I would say is whenever we get synovial tissue, we also try to get paired blood samples, and the reason is that we're looking for biomarkers in the blood. So ultimately, if we could identify biomarkers in the blood, we might be able to obviate the need for the synovial biopsy. So that requires a lot of pairing and probably a lot of luck to get those biomarkers, but that would be ideal if we could simply take a peripheral blood sample and learn a lot about the patient's synovial pathology from the biomarkers in the blood.
Okay, so that's very fascinating. I love this topic. Could talk about it forever. So we touched a bit already on it, but maybe you can expand a bit on what are the biggest challenges or the various challenges in synovial tissue research.
Right, right. So it's hard to say what the biggest challenges are, but there are a number of challenges. I think the biggest one for me is the heterogeneity of the tissue. So when you get only a few biopsies from a patient, you can see very different histologies in those biopsies. So what you need to do is to get lots of samples. And the more samples you get, the more representative of a picture you get about what's going on in that patient's joint. So heterogeneity is a big one. I think another challenge is that what we'd really like to know when we're thinking about pathogenesis of the disease is we would like to know what the disease looks like before treatment. And of course, in rheumatoid arthritis, the name of the game is to get the patient on treatment as early as possible and to treat as aggressively as possible. So now we've modified that synovial tissue with the treatment. And so there's a lot we can learn about post-treatment samples, but if we really want to get at the pathogenesis, we want to get those samples from patients who before they get treated. And so that's hard to get to. I guess another challenge is the cost. So for example, with spatial transcriptomics, one slide that might only look at 2 or 3 cases could cost between $7,000 and $10,000 US dollars. And so that's prohibitive, in many centers. And then also the interpretation of spatial is not straightforward right now. So you really need a good computational biologist to be able to take all of that data that you're going to get from the slides and analyze it properly. So I guess those were the things that I think we'll be working on over time.
Yeah. I have a last question for you, and I was wondering, what are your thoughts on the future of synovial biopsies in terms of application in clinical practice and the future of research?
Right. So I think that synovial biopsies have a place in research permanently. I think it's very important to know what's going on in the tissue. We did a very interesting study many years ago. We were looking at CAMPath1H, which is a molecule that actually eliminates CD4 positive T cells. And we used it in patients with rheumatoid arthritis. It had been used successfully in cancer treatment. In patients with rheumatoid arthritis, it actually wiped out the peripheral T cells, and that lasted sometimes for a year. So some of the patients that we treated actually had ongoing synovitis and went to joint replacement surgery. So we asked the question, what does the synovium look like at a time when there have been really no CD4 positive T cells in the periphery? And we were very surprised to find that the synovium was still loaded with CD4 positive T cells. So, I think it tells us that it's really important, if you want to know what's going on in the synovium, you need to look in the synovium. And we've learned so much already from all of the biopsies that have been done. Using the single cell technique, we've identified new cell types in the joint, and we've identified multiple new pathways, and that's only being expanded with the technique of spatial transcriptomics. So I think there's always going to be a place in research. As far as clinical, to me, the holy grail would be, can we get a biopsy from a patient, analyze that biopsy, and understand what pathways are driving this patient's disease? So that instead of flipping a coin and saying, well, we're going to try an anti-TNF or we're going to try an anti-IL-6, we would actually know what to treat that patient with. I think that would be incredible. We're not quite there yet, but we're inching closer and closer to being able to do that. So to me, that would be, the huge win from all of the work that's being done in synovial biopsies on the clinical side.
I think the future looks very bright from what we all are learning in this field.
I agree. It's a really exciting time in research in synovial pathology.
So thank you very much for joining us. It was a great pleasure to interview you, also for our audience. A lot of insights. If they missed the session, that would be a perfect opportunity to catch up. And thank you all at EULAR TV again for watching us, and see you next time.